Good Morning Iowa.
We're new this morning as AAPI Heritage Month draws to a close. We're also shining a spotlight on mental health in the community. May is also Mental Health Awareness Month. So the group Mental Health America says about 6.1% of the U.S. population identifies as Asian American or Pacific Islander. Now, one of those, nearly 15% reported having a mental illness in the last year. Some race-based issues affecting the AAPI community. Those include things like trauma, especially for first-generation immigrants from conflict areas. So we're so happy this morning to have us live with us in the studio is Malay Bouaphakeo. You are a therapist, a licensed mental health counselor, and also a certified life and leadership coach right here in the Des Moines area. So thank you for joining us this morning.
Yeah, you're welcome. Thank you for having me.
Yeah, so I know this month, as the two months kind of coincide, these are conversations I believe the AAPI community has had for years and years just about mental health in our communities. Can you kind of talk about just how you've seen that those two conversations coincide?
Well, I think that as we kind of evolve as humans, and we as a culture evolve, like the things that are acceptable and not acceptable. One of the things is mental health, right? And then we look at culturally, culturally based. These are things that we haven't normally talked about in this community, and that conversation now, as we become more culturally competent therapists, that is something that we see as a huge need, and a need that isn't really not a lot of resources is available as well. Yeah,
I know one thing that study mentioned is about how some of the younger AAPI people, like myself, we are from immigrant homes. Our parents have gone through trauma. In your expertise, in your work, how do you, encourage people to speak about that or seek help?
The thing is just about representation. I mean, and you know this, doing what you're doing, and just looking at me as a person, I don't think, I'm all tattooed up, I'm Asian, and you wouldn't think that I'm a mental health therapist. And I think that's the biggest thing, is that representation, just showing up as who you are and being that welcoming person. And with that authenticity, I think that's how you start these conversations, and that it's less scary to think about mental health in those ways, because you see someone that maybe looks like you, or someone that you can resonate with or identify with.
How have you been inspired as you continue doing this to be that representation and hopefully encourage other people who look like us to seek mental health counseling?
Continue to be inspired. I'm from small town Iowa, Storm Lake. I think I mentioned earlier. Storm Lake is a huge community of immigrants, specifically in the Lao and Thai and Vietnam community, and that is something that we went to this small town, rural Iowa. Here we are as immigrants. We're here, we're doing our thing, but at the same time, we've kind of had to find our way. And I think as I've grown up, I've just kind of found my way, and I continue to do so. And, really assimilating to the culture in the United States, just shifting how I view myself and look at myself as with not a lot of limitations. So I've always been inspired of breaking kind of stereotypes and doing things that people don't normally think you're capable of, number one, or they expect you to do, So that's how I continue to be inspired, is showing up as who I am and being really unapologetic about it.
I know for me, years ago when I started looking for a therapist, it was really important for me to find an Asian therapist who can kind of understand my background. So for those watching, how can they get in touch with you and kind of seek your help and advice?
Yeah, I think we're going to be putting up my email address later, but Psychology Today, you can find me on there. You can email me at radicaladvocatemb@gmail.com. And then there's also my phone number on the Psychology Today, so that's how you can get a hold of me.
All right, Malay, thank you so much for joining us.
Appreciate
Such an important conversation to have. All right, well, still coming up.